J function. With this treatment, you will be able to carry out lymphatic and venous drainage, depending on the client's needs. Lymphatic drainage is useful in aesthetic and aesthetic medicine fields to contrast all problems like cellulite, water retention, oedemas, and general swellings. With our equipment, we can carry out lymphatic drainage on lower part, upper part, facial drainage, and venous drainage, to decongest and detoxify all venous vessels also. Lympho-J works in a precise and correct manner, following Dr. Vodder's method. Beginning with the most important lymphatic glands, it makes micro-pressures from the inner to the external muscular fibers side. And thanks to the cardiac sensor, optional, we can work in perfect synergy with the heart beating. We can personalize the treatment by following the two different heart phases, the systole or the diastole. Lympho-J function, body and face layout examples. Now you will see some examples of Lympho-J treatments put into practice so that you can memorize the electrodes' positions. At the end of the video, you will find all the layouts for this function. Moreover, all the layouts are included on the equipment's integrated monitor and in the enclosure of the user manual. According to the area and beauty problem, you will be able to personalize your own treatments. Table 2R, lymphatic drainage, body, lower part. To carry out this lower lymphatic drainage treatment, I'll use the bipolar cable with reference color light blue, to which I'll link the optional cardiac sensor. Once applied, I'll insert the plug in the equipment. For this treatment, I'll use 1 long, 6 medium, and 6 small elastic belts, 12 medium, and 4 big electrodes made with conductive rubber and buckskin. And for facial treatment, you must use adhesive disposable electrodes. For this layout, that is for the lower lymphatic drainage, I've used the bipolar cable divided like this. I put all the odd channels on my client's left side and the even channels on the right side, and start working from the most important lower lymphatic drainage point, the Scarpa's triangle, where I place the first violet channel linked to 2 medium electrodes on the glands. On the other side, in the same position, I put the second channel brown. The third, white, is placed on the abdominal area, front and back on the left. And the fourth blue channel is in the same place but on the right side. Following with the fifth channel, the green one, I place one medium electrode on the knee inner side and one big electrode in the popliteal area. On the right side, I'll place the channel number 6, the red one, in the same positions. The channel number 7, the yellow in colour, is linked to a big electrode placed under the calf and under the ankle, and to a medium electrode on the dorsal foot side. The same places are positioned on the right side with the 8th channel colour black. Table 3R, venous drainage of the safena. Let's now introduce you to venous drainage. For this treatment, I'll use the bipolar cable with colour reference light blue. And I'll start by placing the electrodes and the cable, beginning with the lower side, following through to the upper side of the body, because I must follow the natural return circulation of the safena vein. In detail, the first violet channel electrodes are under the sole of the left foot and ankle. The same position for the second brown channel, located on the other leg. Then we follow through with the knee position, where I place one electrode under the popliteal area and the other on the inner side of the knee. I'll link the third white channel on my client's left and the fourth blue one on the right. Let's move up following the circulation of the safena vein, and I'll put one electrode here and the second on the lower leg side, the fifth green coloured channel on the left and the sixth red coloured channel on the right. I'll just show you the last two channels on the upper thigh area. One electrode at the end of the safena way and one under the thigh. I link the seventh yellow channel on the left and the black one, number 8, on the right. Table 4R, lymphatic drainage. Face. For this lymphatic facial drainage treatment, I'll work with adhesive disposable electrodes, putting them in the area which has the most lymphatic glands. Let's see each channel point. I start with the first violet channel, placed at the base of the neck on the left, and the second brown one on the right. The third white one is on the jaw, and the fourth blue one is on the right. Following up, I put one electrode on the periocular area and the other one slightly lateral, linked to the fifth green channel on the left and the sixth red channel on the right. The last two channels are the seventh, yellow in colour, and the 8th black in colour on the frontal area. The first is on the left side and the second on the right side. Lymphoid function, face and body indications, angioedemas and cellulite, improvement of microcirculation, increase in body defences, enhance cicatrization, aiding the regeneration effect, aiding detoxifying effect, improvement of the return of the blood, reduction of inflammations, decongestion of superficial thread veins, improvement of the skin colour, oxygenating effect, prevention of blemishes due to circulatory problems. Good results in cosmetic surgery, before and after surgery. Micro-J function, face, regenerating and firming action of the surface epithelial tissues, prevention of premature aging, filler for wrinkles and mimic signs, anti-age. Now I'll introduce you to micro-J function. With this treatment, you have the possibility of using 3 different wavelengths: sinusoidal to increase the superficial circulation, ramp to enhance skin tone, and the last one, pulsed, to obtain a mini lifting effect. The power is adjustable depending on the client's skin sensitivity, so I will have a low, medium or high level. Also, the frequency is adjustable from 30 to 140 Hz, depending on the effect I want to obtain. For this function, I use the micro-J handles with connector reference color yellow. I can work with 2 different terminal electrodes. The biggest one for large areas, like neck and décolleté, and the smallest one for face and eye contour, where we usually find wrinkles. Once I've removed my model's makeup, I apply a layer of retinol and green tea cream from the EJ Dermo cosmetic line, with some drops of extract essence. This synergic work, carried out together with the micro-J function, gives me the possibility of obtaining the best results with a deep skin nourishment. Usually this treatment lasts 25 minutes, but I'll just give you a demonstration. The use of microcurrents for face treatment is fundamental for the trophism and the beauty of the surface tissues. The face skin shows a person's well-being, the age, any present or derived beauty problems, physical or psychological stress, and so on. Consequently, it's very important that a large part of the aesthetic treatments are aimed to treat face. It's necessary to start early to combat the skin aging process and its consequences: atrophy, wrinkles, tissue dysfunctions that lead to dry or dehydrated, oily or impure, not oxygenated or wrinkled skin. With microcurrents, we are able to stimulate, in an efficient and beneficial way, all those structures that sooner or later will begin the aging process, or to greatly improve actual beauty problems. The microstimulation that uses impulses at a low frequency and low intensity acts on the blood circulation, improves the activity of the fibroblasts, drains and purifies superficial and visible tissues, giving back tonicity to the slackened myofibrils. The delicate skin stimulation through these particular electrodes follows a specific sequence of work in order to obtain a revitalizing, stimulating and toning effect. The treatment is combined with specific products of the EJ cosmetic line for a total synergic action with excellent results visible from the first application.